Good morning and welcome to COVID-19 chat with Dr. David Persse, who's our City of Houston Chief Medical Officer. I'm Stephen Williams, the Director of the Houston Health Department. Today's live stream is an opportunity for our City of Houston employees to get an update on the COVID-19 situation, learn about vaccinations, and ask questions. Please start typing questions now so you have some ready after Dr. Perse's overview. We're asking that you type your questions in the chat window, and we'll get to as many as we can during the 1 hour live stream. We're recording this live stream so employees who can't join today can watch later. Let's start with an update and overview from Dr. David Persse, Chief Medical Officer for the City of Houston.
Hey, good morning, everyone, and thank you, Director Williams, and also thank you to Morgan Ash and the entire team at our communications division for putting this together. So first, we're going to talk a little bit about the positivity rate. We've been hearing about positivity rates for over a year now, and currently the positivity rate is on a downward trend, so that's really good news. The positivity rate, what it really is we take the number of people who are tested every week, and the rate is the number of positive tests divided by the total number of people who got tested. And so you know that as we have fluctuations in how many people get tested from 1 week to the next. And so when we have a lot of people getting tested, we have much more confidence in the accuracy of the number. And so here you can see on this graph the waves, and the purple line indicates the positivity rate. And right now it's at 14.5%. which is coming down, but you can also see that we're pretty high. We're in the 20% range just recently. You can also see the two previous waves. In that first wave, we get up to about 25%. That was extremely high. I also want to remind everyone that the mayor has set a goal for us to be below 5%. So while the positivity rate's moving in the right direction right now, it has been very high, and we still have a long way to go to get down to the 5%. That's really where it really needs to be 0%. But we're looking forward to it being 5%. Positivity rate is also helpful because it kind of predicts what we're going to see in the hospitalizations. And of course, one thing that we need to keep in mind when we talk about hospitalizations is that one of the big things that we wanted to manage throughout the whole pandemic was that if people needed a hospital bed, that there would be one available for them. And we've had problems with that because the hospitals have been so very, very full during these waves. And this chart you're looking at now can show that yet, we are once again on the downward slope of a wave, but the bottom line graph really reflects the number of people who are in the hospital for general and isolation beds. The top line is for the people who are in ICU beds. But if you look at that lower one, you'll see that our most recent wave, we had the greatest number of folks needing hospital beds for COVID alone. And let's keep in mind that at the same time, all of the other things that usually keep hospitals full, heart attacks, strokes, intestinal problems, car accidents, moms having babies, everything else that winds up being in a hospital, that all continued to occur at the same time. So the hospitals have been under incredible burden. And although the numbers are coming down, our hospitals remain very, very full. And in particular, one of the pinch points, as you can imagine, is the emergency department. And so we within the Houston Fire Department and other EMS agencies, not only locally, but across the nation, have been dealing with serious problems of hospitals having to hold on to our ambulance crews because they simply didn't have enough employees in the emergency department to watch all of the patients that were there. Now, I say that, but I don't want anybody to be afraid of going to the hospital. If you have a serious medical illness for which you need to go to the hospital, then go to the hospital. The hospitals are now, they're very safe places in terms of viral spread. Back in the beginning, people were afraid to go to the hospital because they were afraid they would catch COVID. But that's no longer anything you need to be worried about. Overcrowding is a problem. So if you don't have a serious medical problem, don't rely on the emergency care system. Talk to your primary care physician and try to sort it out that way. But if you are having an emergency, you should absolutely use the emergency care system. It's going to be crowded, but they're going to be able to take care of you. Let's go on and we'll talk about vaccines, because vaccines really, that is our way out of this. And the vaccines are highly effective. There's been a lot of misinformation spread around about vaccines, and we need to sort of set that straight. So number one, the vaccines are highly, highly effective. There are breakthrough cases. Nobody ever said that the vaccines were going to be 100% effective. Nobody's ever said that any vaccine is 100% effective, but they are highly effective, not only in minimizing somebody's chances of contracting the COVID-19 illness if you're exposed to the virus, but they're very good at reducing your chances of needing hospitalization or dying. Since the census began, we have seen that nearly all of the deaths have occurred amongst people who are not fully vaccinated. And if you look at this chart here, you will see that this comes from Harris Health, and this is January the 1st of this year through September the 14th, so just a couple of days ago. And you will see that they have had 198 people die from COVID-19. This is for Bentob and LBJ hospitals. 186 of those 198 people were unvaccinated. 7 of them had only gotten 1 shot. They were only partially vaccinated, and only 5 were fully vaccinated. And in fact, I know that those 5 deaths were just recent, because for many months, Harris Health was reported that they had had no deaths from anyone who was fully vaccinated. So they've now had 5. But of course, we're coming on the tail end of this most recent surge. So it's not a big surprise that we would expect that. I want to remind everyone that Moderna and the Johnson & Johnson COVID-19 vaccines are authorized for people 18 and over, but the Pfizer vaccine has full FDA approval for people 16 and older, and it has emergency use authorization for people 12 to 15. So if you are eligible with those criteria to getting vaccinated, you absolutely should, because the vaccines are highly effective. And I think that this graphic here shows that it will not only reduce your chances of getting sick, it reduces your chances of needing the hospital and dying. And let's remember one other thing. This virus, we're seeing a lot of people, somewhere in the neighborhood of 30% of the people who are becoming infected with COVID, with the coronavirus that causes COVID-19, are having long-term problems. They continue to have symptoms for months and months and months afterwards. And that's the adults. And also with the kids, there's this multi-organ inflammatory syndrome known as MIS in children, MIS-C, that we're seeing in a lot of kids. So this virus behaves completely differently than any other virus we deal with. If you get the cold, you get a stuffy nose, you maybe get, you may sneeze a lot, you may feel crummy, but the cold virus really just impacts your nose, right? If you get the flu, you can get really significant body aches, you're going to get high fever, you can get flu or pneumonia from the flu, but it really just attacks your muscles, your overall, body aches, and your lungs. This virus, the coronavirus, attacks every organ system in your body. We have seen people who've got complications with their brains, with their eyes, with their lungs, with their hearts, their livers, their kidneys, their intestines. We've even seen skin complications from infection with the coronavirus. And it has this phenomenon of this long-term consequences that we don't see in other viruses. So this virus is acting very differently. That leads us on to the next question about how are we going to get some prolonged protection. So there's been talk about additional doses and booster shots, and you need to understand these are 2 different things. So the CDC has recommended that for people who are moderately to severely immunocompromised should receive an additional dose, or a 3rd dose, you'll hear, of mRNA vaccine after their 2 initial doses. This is for people where the initial dose, series of doses did not give them really the immune response they wanted because of their immunocompromised state. This is not the same as a booster dose. A booster dose is given to folks who had a good primary response to their initial vaccination, but over time it has waned. And so this is what you're hearing about in the news now, is talk about booster doses. In fact, yesterday, the FDA said it was going to grant emergency use authorization for a booster dose of the Pfizer COVID-19 vaccine for people aged 65 and older, and for the other folks who are at high risk due to severe disease and those who have particular jobs that put them at high risk. And the detail on that will be forthcoming in the next several days, I anticipate. The vaccine advisors for the U.S. Centers for Disease Control, they're discussing, and they're meeting today to discuss some of those specific the more specific definitions of what the recommendation will be. And the CDC must give a stamp of approval before any booster doses can be officially given. And then we also want to talk about the vaccine sites where you can get vaccinated. And so if you want to get vaccinated, there are many sites around the area. And the Houston Fire Department, Houston Health Department offers vaccines at a number of sites, and you can find the one nearest you. It's really easy. You just go to houstonhealth.org, or you can call 832-392, 832-393-4220. You think I get that right? I've only said that phone number 10,000 times in the last year. 832-393-4220. We also are offering the gift cards for for those folks who would need a little bit more incentive. So if you go through the City of Houston sites, you're going to get $100 for your first shot, and then when you return to get your second shot to complete the series, you can get an extra $50. And we've been doing that for some time now, and we expect to continue doing that in the future. Now, you do have to complete that series within the 42 days, however, because that's the requirement per the manufacturer. So again, you can learn more about that by going to houstonhealth.org or calling 832-393-4220. I think with that, I hand it back over to Stephen. Director Williams.
Thank you, David. I just want to emphasize something regarding the gift cards. Again, the program is only for gift cards is only at eligible Houston Health Department sites within certain time frames. We know the county is running a parallel program, and they have a process whereby you can get reimbursement for them for your first shot at any site, but you have to show proof of vaccinations. It's also my understanding that we're experiencing some issues with our chat feature. So we want folks to please email questions to hhdcommunications@houstontx.gov. hhdcommunications@houstontx.gov. One of the things I want to emphasize for folks, because I know things are opening up, schools back in, is that we're really still in a pandemic. We are in a pandemic. You saw the information that David shared. Yes, some of our numbers aren't quite where it was last summer when we were at our peak, but it is still at a pandemic level, and we really need to take this very seriously. I'm going to ask the first question, David, until we get some questions from some of our colleagues at the city. Will COVID-19 vaccines give me COVID-19? This is something that I have heard at a number of our vaccination sites.
Yeah, this is a great question. Thanks for bringing it up. So the answer is no. So if you understand what the COVID-19 vaccines are, they take the entire sequence of the mRNA that creates the virus itself, and they just take 2% of it, the part that makes the tip of that spike protein, and that's what's in the vaccine. And that when you get that injected, your immune system recognizes, well, what is this? This isn't supposed to be here. It learns it, and then it builds a defense network against it. It doesn't give you COVID-19. We often hear the same thing when people get the flu shot. And that, oh, I got the flu shot and it gave me the flu. So no, it didn't happen. What happens is when your body is learning about this new virus, whether it be the flu or the coronavirus, your immune system reacts. And so that may give you some symptoms. You may get a little bit of fever. You may get some body aches. You may feel crummy for a day or two. That's a good thing. That's your immune system reacting to the immunization, to the vaccine, and building its defenses. You haven't contracted the illness, but your immune system is waking up, and it causes some symptoms sometimes. And people often will confuse that, thinking that they got infected. They didn't get infected. That's the immune system doing exactly what it's supposed to do.
Yeah, I'm glad you mentioned the flu, because we're entering into flu season and flu shots are available. And it's recommended that you can get both the COVID vaccine and flu shots. As a matter of fact, we're giving both COVID vaccine and flu shots at some of our sites. Will getting a COVID vaccine cause me to test positive on a viral test?
Oh, another good question. The answer to that, again, is no. When you get the viral test, what we're actually looking for with the swab in the nose is what they look for in the lab is they look for fragments of the entire mRNA sequence. So when you get the vaccine, you just get 2%. You just get a little bit of it to wake up your immune system to look for the virus. But when we're testing for other parts of the entire mRNA virus, the mRNA that makes up the virus. And so no, you won't get a false positive because you were vaccinated. So it doesn't cause that cross-reactivity, so no.
Okay, we have a question coming in from one of our City of Houston colleagues. What do you mean by when the vaccine wanes over time? Shouldn't it be as effective as when we first got it?
Yeah, so this is a great question. And, there are some illnesses for which we have vaccines that when you get vaccinated, you can get many, many years worth of protection for that. So examples I'll use include tetanus or measles, mumps, and rubella. Those are two vaccines that most of us have gotten. So with measles, mumps, and rubella, for example, it's a 3-shot series. Most of us got it when we were kids. But there's another example of a vaccine where it took more than one dose. With tetanus, you got that as a child as well. But actually, you didn't have full immunization with that until after you got 5 doses. So then with tetanus, you're basically pretty well protected. But about every 10 years, you should get a booster because your immune system, it starts to just, if you don't get exposed to tetanus, it's just not going to, it has a memory and it will lose that memory over time. One thing that I want to point out with folks is with the flu vaccine, and we'll keep talking about flu as a common ground that people remember. So we recommend people get a new flu shot every year. That's not because of waning immunity. That's because every year the flu virus changes a little bit. So the flu, it impacts us here in the northern hemisphere during our winter. It then goes to the southern hemisphere, and then it comes back for our winter again. It goes to the southern hemisphere during their winter. And so what the vaccine manufacturers do is they look at what is going on in the southern hemisphere because viruses will mutate. We've seen this with the coronavirus. We see it every year with the flu virus, a little bit of mutation, actually enough mutation that we get a new shot every year. That's a little bit different from waning. And so with the coronavirus, remember, the flu virus and the coronavirus and the vaccines are completely different. The flu virus is a completely different virus than the coronavirus is. And so we're starting to see a little bit of waning among some folks. In particular, it appears that those over the age of 65 and those with some immune system issues, their the protection may wane over some number of months. This is exactly the questions that the CDC will be answering for us in the next couple of days. So
Okay.
it's a common thing that we see that.
Is there a difference in the dosage amount for booster versus third dose?
No, so the dosages remain the same. You are hearing differences in doses as we're talking about kids. So the Pfizer just this week came out with a report showing that they had done a study in kids from the ages 5 to 12. Now that is a different dose. It's a lesser dose for 2 reasons. One is kids are smaller. And number 2 is their immune systems are far more robust than us as adults. And so they respond much more effectively and efficiently. So they need a lesser dose. But for the booster doses and the third dose that we've been talking about for adults, those are the same dose.
Okay, I know that Moderna is actually looking at the possibility of maybe half of a dose for a booster.
That's right.
But the current information is that for Pfizer, it is the same for the third dose and the booster. And we'll have to wait and see for Moderna because that's going to be a couple of weeks, hopefully, behind Pfizer. When will the original vaccine be updated to include protection against all the emergent variants?
Well, that's a $54 million question.
Absolutely.
Yeah, I don't think that we know. If I were a vaccine manufacturer at this point, I mean, I would be looking seriously at tweaking the formula a little bit to maybe cover Delta. But the problem is that we don't know what will be next. And so, without that crystal ball, being able to predict what's going to come next, it's hard to know how to tweak the formula.
And I think this is a related question that's also from one of our colleagues. What needs to happen for a pandemic to be called off? I can't wait for that time to happen. Go ahead.
Yeah, so that will the World Health Organization will be the entity that we will be listening for that good news. And I don't know, to be honest, I don't know what their criteria will be. It's been over 100 years since we've had a global pandemic like this, and so I don't know what it's going to be. I anticipate it's going to be a long time from now. We've got to remember, there are entire nations around the globe where they've basically not gotten any vaccine. There are very large nations where less than 10% of the people have even gotten their first dose yet. So unfortunately, I think that this is going to go on for quite a long time.
Yes, I think it is. And I think this is also where we encourage people who are unvaccinated to actually get the vaccine because that is our best shot at really getting this pandemic under control. Do COVID-19 vaccines contain microchips? I've actually heard this a couple of times.
Yeah, no, they don't have microchips. Uh, Here's one thing when people ask this question is if the government wanted to track you, they would just track your phone. It's so much easier to track your phone than putting a microchip in the vaccine and try to track you that way. So there are no microchips in the vaccine, and the conspiracy theorist in me says that if the government wanted to track me, what I'm doing, they'd tap into my phone somehow. Be far more. They could hear what I'm thinking. If they could do it, they might be able to turn it on, and so they could listen to my conversations. They know exactly where I am. There'd be so much more information that they could get if they did it that way. So I don't know. There's no microchips in the vaccine.
It's probably not the government that's tracking us. It's probably Google, so that they can encourage us to buy stuff.
Yeah.
When should I get tested? All of these are coming from our City of Houston employees. When should I get tested?
Yeah, so that's a good question. Certainly, you should get tested if you think you have symptoms. Absolutely, you should go and get tested if you think you have symptoms, because that will then empower you to be able to make better healthcare decisions for yourself. It'll also allow you to protect your family from you accidentally, inadvertently infecting them. We also recommend, or at least I recommend, that you get tested on a regular basis, because we do have this phenomenon where people are asymptomatic and getting infected and able to spread the illness. Remember, about 40% of people never develop any symptoms at all. They get infected, they spread it, and they never even had any symptoms. So in an ideal world, you would probably get tested weekly. That's probably not practical for most folks. So a good hedge on that, what I do is I get tested every other week. Again, in a perfect world, I would get tested weekly, but I can't work. I got a job, I got work to do. I can't take that much time. But certainly, if you've got symptoms, you should absolutely get tested.
If the virus is airborne, why do we have to mask and spread out? Because it's airborne. Go ahead.
Yeah, it's because it's airborne. So in the beginning, if you recall, we thought that it was going to only be spread by droplet. So with droplet spread, which is kind of what you see with the flu, somebody basically pretty much has to cough in your face, right? You have to be close up when somebody cough or sneeze really close to you. And as an emergency physician, I can remember many times examining somebody with a sore throat or whatever, and they would just let off a cough right as I'm sitting there talking to them, and I knew, bingo, I just got infected, right? But when it's airborne, the difference is that it will linger in the air, it will float in the air. And so while we talk about 6 feet in 15 minutes, we really need to wear the mask more than that, because it will linger in the air and float. And we've seen many studies of people in restaurants where if they're downwind from the air conditioning, 2-3 tables away, people got infected. So it can be blown around. That's why you need to wear a mask. But a couple of things about the mask. Number one, you don't wear the mask. Well, you do. You wear the mask to protect yourself, but it actually does a better job of actually protecting you from infecting someone else if you don't know that you've got symptoms. It actually catches more of that's the simple mask. If you have the N95 mask, that does a better job of protecting you. But it's a two-way street. So you're not only protecting yourself, you're also protecting others if you're infected and don't know it.
Can we make it mandatory? And I'm assuming they're saying, can we make getting a vaccination mandatory?
Yeah. So
go ahead. I
well,
think that was our current city policy. Well, the one that will go into effect in a couple of weeks, but go ahead.
Yeah. So getting vaccinated, the governor has basically outlawed that. The mayor is putting together, we're working on a testing mandate for city employees. With the exemption, you can get out of being tested or having the requirement to be tested twice a month if you get vaccinated. So that's to encourage folks to get vaccinated. And that would be, a smart thing for people to do for, now just one more reason for people to go ahead and get vaccinated. But the governor has basically outlawed any sort of vaccine mandate.
Okay, I have a question, and the answer might be a little bit long. Where do employees upload their COVID vaccine documents, biweekly test results for EO 71 policy? I'll read this, David.
Okay.
The bottom line is that some of the processes here are still being finalized, but this is what we know now. EO 1-71 will be implemented on October 8th, 2021. The first reporting testing period ends on October 15, 2021, and will be for COVID-19 tests performed from October 1 through October 15. All documentation will be uploaded to a secure portal via your computer or mobile device. Information provided in this secure portal will be stored in accordance with applicable laws. All information collected is considered confidential, and access will be on a need-to-know basis. All employees opting to request an exemption to the testing requirement will be required to upload proof of COVID-19 vaccine, i.e. COVID-19 vaccine card, COVID-19 vaccine record from your health care or vaccine provider, MyChart, or similar medical records app, or other approved forms by the HR director, regardless of if you entered your information for the $25 Healthy Rewards incentive. I think that's really good to distinguish that. Exemption forms or other forms for compliance are being vetted. Once forms are approved, they will be sent out via communication that will be broadcasted to all employees. Testing should be completed on your own time. Appropriate accrued leave may be used to test or receive your vaccine if you choose to schedule such services during your working hours. Any absence away from work must be approved in accordance with your department's absence policy. Employees are encouraged to use free testing sites provided by the state, county, or our local health department. If you choose not to use one of the free testing sites, or if a site bills or submits the testing costs to your health insurance carrier, you may incur costs, copay, and/or deductible associated with COVID-19 testing by your healthcare insurance carrier. All tests must meet the criteria set forth in paragraph 5.1.1.1. Approved PCR molecular tests and must be supported by documentation from a healthcare provider or eligible laboratory. Excuse me. Home tests that are not performed, processed, analyzed, and documented by an eligible laboratory or healthcare provider cannot be used. More information on requests for an accommodation and systems access will be coming soon. I just read that so people will get an idea of what's coming forward. The bottom line is stay tuned, but the bottom line is also that employees will be required to actually seek tests on their own if they're not vaccinated. Can receiving a COVID vaccine cause me to become magnetic? I know you answered that, David. The answer is what now?
The answer is no. We've seen these, videos of people who I don't know, what they're doing to make that, but the vaccine, there's nothing metallic in it. It doesn't make you magnetic. You see these videos. I don't know what gimmick that they're using, what kind of sticky stuff they're using or something, but no, you're not magnetic.
Yeah, I know actually, in talking to a couple of colleagues, that question has come up in work environments. Can you explain mandates being lifted and reinstated?
Say again?
Can you explain mandates being lifted and reinstated? Why are so many businesses forcing the matter and others not? Good question.
Yeah, it is a good question. Well, I think a couple of things. First of all, this whole thing has become very politicized, which is just tragic. Don't get me started. It's just there are two different things here, right? We're talking about people's rights versus the science and the biology and and taking care of folks. And a lot of businesses are sort of caught in the middle. So there are a lot of pressures on business owners right now from employees and customers alike to either, for example, have a mask mandate or not. And so businesses, they can make up their own decisions what they want to do. The governor has largely, taken the ability of local government away for having such things. So it's left up to the business owners. And like I said, a lot of them based on their employee pressures and or the pressures from their customers as to whether or not they're going to have mask mandates. And so you're seeing inconsistencies from one to the next. You're also seeing inconsistencies with not only masks but vaccine policies by some employers. And I think it's going to continue that way. And I don't that's probably a lousy answer. Stephen, you may have a better insight, but that's what I have to offer at this point, is that they're just struggling.
I think you have to look at just the cities, from a corporate perspective. Uh, Basically, we're responsible for, the continuation of government. And the reality is that if you have significant number of employees that are out, that really compromises our ability to do the people's work. And so, therefore, I think businesses are similarly situated. Their bottom line might be a little bit different, whether they're a profit or a nonprofit, but the idea is to try to ensure that your operations continue. And I think that's why you see a lot of businesses really requiring masks. And also, they realize that by not requiring masks, especially for a number of restaurants or whatever, people just won't go. And so, therefore, their businesses will falter.
Let me just add one thing. I just want to remind folks that, on Tuesday of this week, I attended the 4th funeral for an active duty firefighter who died of COVID. And we also have another firefighter right now who's in the hospital. He's on an ECMO machine, which is basically a heart-lung bypass. And he's on the transplant list to get lungs. And if he should get the lungs, if he doesn't, I mean, he could still die. If lungs don't come available in time, he may still die. But even if he gets a pair of lungs, he's not going to be able to return to work, not as a firefighter, certainly. And so there are incredible consequences to getting sick. And, that's on a personal level, but also from the business standpoint, you've got to keep your workforce. You got to do what you can to protect your workforce and your customers. And so it's very difficult times.
When should people get the vaccine if they were COVID positive? Also, when should people get their second dose if positive in between doses?
So if you're infected and you recover, the recommendation is you wait 90 days, about 3 months before you get immunized. And now if you're in between doses and you become infected, I don't know that I know the recommendation for if you're in between doses. But I would apply the 90 rule, the 90-day rule to that situation. I don't know if there's a specific one if you get infected after your first but before your second dose. So I would apply the 90-day rule for that.
Does getting the vaccine mean I can't catch or spread COVID-19? Then why does EO1-71 make it an exception? Well,
yeah. Well, so no, if you're immunized, and we talk about breakthrough cases. Now, people who are immunized and become infected, yes, they can still spread it, but far less likely to be able to do so, especially if they're without symptoms. Now, if you're a breakthrough case and you have symptoms, you shouldn't be coming to work, right? You should go home, you should get tested, find out you're positive, and you should stay home from work. So the question is really talking about those folks who are immunized that are breakthrough and they have no symptoms, and there's going to be a tiny number of those people. And so, part of the whole point of this is to create an incentive for people to get vaccinated. So yeah, there is a chance that a vaccinated person, employee, could become infected and unknowingly spread, but the numbers are going to be really, really tiny, far smaller than the risk of an unvaccinated person who is, there are going to be many more people, or much greater risk of unvaccinated people becoming infected, coming to work, and either never developing symptoms, or in that, the 2 to 3 days when they're spreading virus before they develop symptoms. That's the risk. That's what the mayor's trying to prevent. That's the higher risk.
but the bottom line is, if you accept a responsibility and actually get vaccinated, you're doing all that you can.
Yeah, that's right. And it kind of goes to the other thing, is that if everyone in Houston or in Southeast Texas was vaccinated, we wouldn't have this problem. Remember, the virus has to have an opportunity to spread, which means it needs to have unvaccinated people in the environment in order for it to spread. If everybody's vaccinated, it's never going to get traction. That's why we don't see measles. Measles is still rampant in Europe. They don't have the vaccination levels that we've got here in the United States. When was the last time you heard about a measles case? It's rare that we have a measles case in the United States. That's because we've got such high vaccination. Are there people in the United States who are unvaccinated? Sure, there's a small number of them, but the measles virus never gets to them because they're basically surrounded by vaccinated folks. So the virus never gets any traction. That's what herd immunity is all about, and that's where we need to get, and we're not quite there yet.
Yes, but there is an alert that just went out about measles, just because of some of the Haitian immigrants have tested positive for measles. And so therefore, they are cautioning people who are living in environments around some of those shelters and military bases, the doctors to actually be on lookout for that.
Yeah.
Not all doctors are reporting the VAERS. What are what are the long-term symptoms? I think you need to explain VAERS first.
So VAERS, VAERS, is the Vaccine Adverse Event Reporting System, and it's open to the public. Anybody can report a what they think may be a vaccination complication to VAERS. One problem, so that the good thing is that it takes all information that anybody sends to it. The bad part about it is that it doesn't have great there's no vetting really of the data that's in there. And so what I would invite you just Google it. You can go to VAERS and you can actually get into the individual reports. I've done this many times, and you'll get a sense yourself. Sometimes the reports are very detailed, and clearly there is an association between what the person's complication was and them getting vaccinated. Most commonly, it's when they had what's called an anaphylactic allergic reaction to the shot, which generally occurs within 15 to 20 minutes after the shot. That's clearly an allergic reaction from the immunization. Those are extremely rare. But you'll also see things in there as outlandish as a person was vaccinated against whatever, measles, flu, whatever, and 3 months later they're in a car accident, and the person reports that they think that was because of their vaccination. And I'm not making this up. You go and check yourself. So the one thing that's good about it is that it's widespread and anybody can report. The bad thing about it is that there's really no vetting of these cases to see whether the reports are actually related to the vaccine. And so you're right. There may be doctors out there that are not reporting. I don't know of anyone who's not reporting, but there may be doctors out there who are not reporting. But that's certainly balanced by lay people who are reporting things that they may not be able to understand whether there's actually a relation to the vaccine or not.
So give us some examples of some long-term symptoms of what has been termed as long haulers.
Yeah, the most common one the one that I was going to say is the most common, the one we're hearing about mostly is the brain fog. And so, one of the common symptoms we have with people who are infected is that they lose their sense of taste and smell. And that's because there is a way for the virus to get into the brain. And one of the first things is because it goes right across from the nose, right to that lower part of the brain where your taste and smell center is, and it impacts that. And a lot of people lose their sense of taste and smell. But it can also once it's there, it can get elsewhere in the brain. So one of the most common things we're getting is people with this brain fog. And brain fog, the people that I've talked to said they have trouble remembering things. In particular, their short-term memory, they don't know where thhere going. They forgot, where am I going? I'm driving. I forgot, where am I headed? I forgot. A lot of short-term memory problems. Also, inability to do some simple calculations, like, they used to be able to figure out the tip on a check. So you're at a restaurant, you get a tip, and I want to give 15%. So quickly in your head, you do the math. They find they can't do that anymore. They struggle trying to figure out simple mathematical problems. Trouble with names of people that they've known for many years. And so a lot of memory problems, a lot of computation problems, and this is the brain fog that we're hearing. But people are also having other long haul symptoms. It kind of depends on which organ system that the virus seemed to attack in you. And as I mentioned earlier, we've seen eye problems, brain problems, liver problems, kidney, intestinal problems. So we're seeing people are having prolonged GI symptoms, for example, and cramps, diarrhea, whatever organ system that the virus seemed to attack the most in you is the one that commonly people are having long haul symptoms. And again, even what I just said is not absolute. We've had folks who've had fairly mild, problems with their illness to get over it, and then all of a sudden they get hit with this brain fog. So it's again, this virus is breaking every single rule.
Okay, you mentioned the Pfizer booster and the lower dose Moderna booster. I guess we should explain what we were talking about.
So the Pfizer booster has already been approved by the FDA, and that's what's going through the fine tuning right now with the CDC. And that's a full dose. Moderna has done research looking at a lower dose for their booster, and they've submitted that to the FDA, but the FDA has not commented on it or made any decisions about it. So the one difference is the Pfizer, when they did their study, they submitted it to the FDA. That was full dose. Moderna did a study. It was half dose, or at least lower dose, and that's what they've submitted to the FDA. But the FDA hasn't had their committee meetings on that yet, so we have to wait and see what that's going to say.
My friends are just making appointments and getting a third Moderna shot. Is it harmful?
Yeah, good question. So we're not hearing of any folks being harmed by it. I've not heard any reports of that. In fact, what I've heard of people who've gotten, whether it be their third dose or they've gone and gotten a booster dose, that I've heard a lot of folks have had very minimal, if any, side effects. The side effects, the achiness, the fever, the expected side effects. I've heard very little of that. So it's not likely to be harmful. It may be wasteful in that if you're somebody who's got you're young and healthy and got a really strong immune system, you may not really need it. And today, because we have more vaccine than we have people asking for it, it's probably not too much of an issue. Remember, there was a time when we didn't have enough vaccine for everyone. And then the other thing is you need to, again, we mentioned this earlier, but you also have to consider the global impact. So just this morning, I heard the United States is going to be getting several million doses to provide vaccine to third world countries and places that don't have it yet. Again, and it's important for us because the next variant is going to be one which is more effective at spreading than the current Delta. That's what will make it the next one, is that it spreads more effectively than Delta spreads. We do not want that to happen. That is almost certainly going to happen in somebody who's not immunized, right? Somebody who's not been vaccinated. And so it is in all of our best interest to get everyone on the globe to be vaccinated so we don't get the next pandemic from the next more effective mutant.
If I receive my first shot in April and haven't gone back for my second due to reactions, could I or would I have to start over?
So
No.
yeah, the FDA is really recommending that you get it within 42 days. But if you're beyond that, go ahead and get your second dose. It'll probably still work just fine. But you do want to get it within the timing because we know that it works if you get it with the proper timing. That's what was investigated. That's what was studied by the manufacturers. So we know it works then. If you wait too long, there's a chance it may not kick in as well, but probably it's going to be fine. So I would absolutely go and get that second dose.
The recommendation is that even if you're over the 42 days, just go ahead and take that second shot.
Just go ahead and get it. Yeah.
If I am fully vaccinated, should I still wear a mask indoor like the grocery store? I do.
Yeah.
What do you think, David?
Yeah, I do too, and for two reasons. And the two reasons I said earlier, one is it does provide me some level of protection. When I go to the grocery store today, I find that the grocery store that I go to, almost all the employees are wearing their masks. Not all of them, but almost all the employees are. But I'm pretty much the only customer that's wearing a mask, unless it's, I see a lot of elder folks wearing masks, but most of the folks not wearing masks. So I wear the mask to protect myself because you know what? There's a good chance that one of those folks is unknowingly spreading virus. And then again, there's a chance that even though I am vaccinated and I don't have any symptoms, is there a chance that I could have and be able to spread it? Absolutely. And I'll tell you what, I do not want to be the person who spreads it to somebody else. I have seen what this virus can do. I've seen people die of it. And I would be so guilty. I would feel so terribly guilty if I ever find out that I passed the virus on to somebody who had a bad outcome. I just wouldn't be able to live with myself. That'd be horrible. And I will share with you that we do know many cases where family members infected other family members who died, and those family members who unknowingly, unintentionally infected their loved one who wound up dying, they are dealing with significant depression and emotional problems afterwards because they're feeling so guilty, and it happens. And I wear a mask for all the reasons I just stated.
There are horror stories about places like Idaho having to ration care because of COVID. What can we do to prevent that?
Well, the quick answer is get vaccinated. Our hospitals have come dangerously close during this last wave to having to do that. Director Williams and I meet with the Texas Medical Center CEOs weekly, and we've been able to have very frank conversation with them, and they have been able to tell us just how close they have come to having to ration care. And we didn't have to do it here, but they were extremely strained, and a lot of it had to do with the nursing shortage. So if there are any nurses out there who are licensed and experienced and thinking about getting back in the job market, we could sure use your help right now.
If a person is vaccinated and contracts the virus, should that person quarantine?
Yeah, so actually the word would be isolate and yes. So if you've contracted the virus and you're symptomatic, you are capable of spreading it and you should isolate just like anybody else would. So it's the same, generally it's 10 days. At the end of that, you have to be fever free for 24 hours and whatever other symptoms you have, they need to be improving. And generally by that point, most people are symptom free. Or by the 10 days, unfortunately, your symptoms are not gone. And generally at about 10 days, you're either a whole lot better or you're getting worse, in which case you may wind up being one of those rare cases of somebody who needs hospitalization. So it's the same rules apply as whether you're vaccinated or not once you develop symptoms.
Received J&J vaccine in March 2021. Should I wait for the booster or get the Moderna or Pfizer?
Wow, that's a good question. So, Johnson Johnson just came out with a study that just got published. They came out with a press release that hasn't actually been published yet, and they're submitting the data to the FDA that shows that if you get a second Johnson Johnson dose, you get extremely good response. So what I would do if I were you is I would just give this a little bit of time and see what the FDA says about the new Johnson Johnson, because that way you may, instead of going and getting a 2-dose series of a different vaccine, you may just need to wait a little while and get your second Johnson Johnson and be just as well off.
Okay, David, they said we're going to have a lot of questions coming in, so you're used to rapid fire, so I'm going to do this, okay? Any
Yes.
any advantage to wearing gloves?
Yes, it's minimal, but yes, there is. The virus doesn't spread really well. Like the flu virus spreads great on doorknobs and keyboards. The flu virus is great at spreading that way. Coronavirus, not so much, but can it? Yeah. And so if you're really worried, wearing gloves isn't going to hurt.
Why are people still getting and dying from COVID after full vaccination?
So some folks, the vaccine is one of the reasons why vaccines are not 100% protective, is because some folks, the vaccine doesn't, your immune system doesn't respond as fully as in other people. And sometimes it's because you've got a chronic illness. Other times it's just your DNA, you don't respond well. And then folks, they can become infected and get really sick. We see this with every vaccine. No vaccine is 100% effective.
Should people who had COVID take the vaccine? Yeah.
Absolutely, yes. And let me tell you one of the reasons why. We've amazingly, a lot of the folks who've had long haul symptoms, once they get vaccinated, they have tremendous improvement. Not necessarily, completely going away, but they are a lot of reports of people who were ill, had long haul symptoms, got vaccinated, and got much better. Here's the other thing: is even though you were infected before and you have some immunity from it, from one person to the next, the amount of immunity you get post-infection is quite variable. So you don't really know how well protected you are from your previous infection. So you should go ahead and get vaccinated, and then you should be really well protected.
Will the bi-monthly COVID test be covered by your insurance? Actually, I don't know that we know the answer to that.
Yeah, that's going to.
The advice really would be just choose a site that's actually free. There are a number of free sites that are in the community.
Yeah.
Go ahead. What can we do? What can we do to boost our immunity? Now that positivity rate is going down, can we go to the gym if we're not vaccinated? My God, the positivity rate is still high.
Yeah, the positivity rate is still very high. 14% is still very, very high. Remember, at 20%, which we're not that far from, that's 1 out of every 5 people. So I would still be very careful.
If a child at home has COVID, should I quarantine too? Will a person test negative after 10 to 14 days?
All right, good question. So if you've got somebody in your household who's positive, then you should quarantine. Then remember, the people who are infected, those are the ones who isolate, and quarantine is for folks who are exposed, but you don't know if they're infected. So yeah, you should quarantine. And then the other part of the question is, will I test positive? What was the second part?
Will I test positive after 10 to 14 days? The answer, test negative after 10 to 14 days. The answer is maybe. Go ahead.
Yeah, maybe. So if you get, first of all, you need to get a PCR test. And if you're exposed to somebody and you think you may be exposed, really the recommendation is you wait at least 5 days after the exposure to test. But you should, because that's when you're likely to begin becoming positive. Getting tested before then is probably not, you run the high risk of a false negative. But if you wait 5 days, you can test to find out if you're positive. You still need to quarantine for the full amount of period, because you may not test positive to day 12 or something like that. And that's why it's a 14-day thing. Now, the other part of the question maybe they're asking is, if I was infected after 10 days, will I still test positive? And the answer is yes. People very often are testing positive, even though they're beyond the 10 days, their symptoms are gone, their fever's gone. This is one of the reasons why the CDC doesn't recommend that you use a testing policy to get out to determine when your isolation period ends. It really needs to be fever and symptoms, because people will continue to test positive because you're still going to have some viral debris, and the test is sensitive enough that it will pick that up and you may continue to test positive even though you're completely cured.
Should I get tested if I'm vaccinated?
So I do, because like we said, so I'm not 29 years old anymore. I'm pretty healthy, but there's a chance that my immune system didn't respond as well as I think it has, and so I continue to get tested. So yes.
Do you recommend booster for a younger adult 31 with no underlying health conditions? I think we should wait to see what the recommendations are.
Yeah, the recommendation, I don't think what we're hearing, I don't think the recommendations would apply to that person.
Will wearing a mask keep me from getting?
It will reduce your chances. Yeah, it depends on the mask. If you've got a cloth mask, the more layers to it, the better it's going to work. And if you have an N95 mask, that works better than the cloth masks. It'll help. It's also really helpful at you not spreading it unknowingly to the person next to you.
Which COVID test is preferred, PCR or rapid? We prefer PCR.
Yeah, the PCR is far more sensitive and far more specific. The thing with the rapid test, if you're symptomatic and you get a rapid test, they're like 95+% accurate. But if you're asymptomatic, there's about a 20% false negative rate. So that's the problem with the rapid test, is if in the asymptomatic people, there's a respectable false negative rate.
If we don't know how long the initial vaccine lasts, why would a booster not be recommended? That's not exactly accurate. Go ahead.
Yeah. So there's a confusing question. Read it again.
I'll read it again. If we I think if we don't know how long the initial vaccine lasts, why would a booster not be recommended? Actually, there have been studies to see exactly.
This is why the recommendations are coming out the way that they are, that are suggesting that people over 65 and those with immune illnesses, because they've been monitoring individuals, the manufacturers have been monitoring individuals to see what their antibody levels are. And as we get older, as we get to be 65 and older, our immune systems are not as robust as they were when we were 30 years old or 15 years old. And so it's not a huge surprise that those are the folks who will be having some waning. Again, with people who've got immune system diseases, their immune systems may begin to wane after a certain amount of time. So that's what the recommendations will focus on, those folks where it appears to be waning. For the rest of us, for the rest of the population, the young, robust, healthy, like was just talked about, they're probably not waning at all, and therefore the booster is not recommended for them.
Why are some doctors spreading misinformation about the vaccine and not being punished for it?
Yeah, so some are. Some have already lost their medical license. There are others that are under investigation. Personally, I think that's terribly unprofessional. And pretty much every state has a clause in their licensing laws that talks about responsible professional behavior. And so for those that are spreading, like I said, some have already lost their licenses and others probably will.
When will the booster be available for HHD staff? Most people in the Houston Health Department probably got Moderna vaccine, and Moderna's booster hasn't been approved yet. If you got Pfizer and you meet the criteria, then it will be available for you. Can a person who is unvaccinated donate blood?
Yes, you can donate blood. The blood bank has a way of screening your blood to make sure that that you wouldn't infect somebody else. But yes, you can donate blood. And by the way, we are experiencing a significant blood shortage right now. So I would encourage everyone to go and donate blood.
I think I'm scheduling myself in for next week. I'm vaccinated. Is it safe to eat at restaurants? Wow, Persse, I want to hear your answer to that.
So I will tell you, it's pretty much the same answer we've been saying all along. And this is what I do when if I'm eating outdoors and the tables are spaced far enough away, then I'll feel pretty comfortable with it. I'm not comfortable with crowded indoor places, even though I'm vaccinated. So I'm very uncomfortable with that. So I haven't been eating indoors and crowded. Now, well, quite honestly, what my wife and I will do is on a Saturday afternoon, we may go to our favorite restaurant, but we're going at like 4:30 in the afternoon after the lunch crowd, before the dinner crowd, and there's like, hardly anybody there. So that's what we've been doing.
If an employee shares space with someone who tested positive, report to work while waiting for the test results. Let me
So,
try. Go
yeah.
ahead.
Well, if it depends on if you meet the criteria for being an exposure. So if you're, right now we're using the rule of thumb of less than 6 feet for more than 15 minutes. And so most coworkers in the office setting are probably more than 6 feet away from each other. And, if you've got a decent air management system, the air filtering system, you're probably okay. But if you're like shoulder to shoulder with them all day long, then you would be an exposure. And so you should then quarantine.
The vaccine does not prevent anyone from getting COVID. So why aren't fully vaccinated people not asked for a negative test bi-monthly?
Yeah.
Talked about that a little earlier.
Yeah, we talked about it, and I think that the first part of the question, so the vaccine does protect people. It greatly protects. We had a graphic up earlier that showed the impact it's had on hospitalizations for the Harris Health System. It greatly protects people. But again, you're right, it's not 100%. And so the thought is that, or the belief is that if a vaccinated person were to become infected and not know it, and they were to come to work, they might be able to spread it, but far less effectively than an unvaccinated person who comes to work even before they have symptoms. And so they're much less of a risk. So the goal is to get people vaccinated.
Yeah, I don't think that we can stress that too much. Certainly masking helps, social distancing helps, but we know that getting vaccinated is the best way for us to get control over this pandemic. It's the best way to protect you. It's the best way to protect your loved ones and your coworkers. We wouldn't be pushing these vaccines if we didn't think that it was our best strategy to really deal with this pandemic.
Agreed.
That's all you're going to say about that, Persse?
Well, we've only got 1 minute left, so you told me to be quick. Rapid fire, rapid answer.
Oh, well, I really appreciate that. I want to thank you for the valuable information that you provided. I think you've been doing an excellent job as the City of Houston's Chief Medical Officer. As a reminder, you're watching COVID-19 Chat with Dr. David Persse. This is specifically for the City of Houston employees. This event was recorded and will be shared with employees. I want you to also please visit houstonhealth.org or call 832-393-4220 for information about vaccination and testing sites near you. Please also follow the Houston Health Department on Facebook, Twitter, Instagram, and YouTube for frequent updates and for information. Once again, I'm Stephen Williams, Director of the Houston Health Department. Together, by getting vaccinated, we can save lives, put this terrible chapter of our lives behind us. Please continue to mask up in public settings. Have a good